Top 25 residential care worker interview questions and answers. Working as a residential care worker requires compassion, patience, and a strong commitment to supporting individuals in their daily lives. This role involves assisting residents with personal care, emotional support, household tasks, and promoting independence. Employers look for candidates who are empathetic, reliable, and skilled in managing challenging situations. These top 25 interview questions and answers will help you prepare effectively, demonstrate your strengths, and confidently present yourself as a capable residential care worker. 1. Why do you want to work as a residential care worker? I want to work as a residential care worker because I am passionate about helping individuals maintain dignity, independence, and quality of life. I enjoy supporting people in their daily routines and building meaningful relationships based on trust and empathy. This role allows me to contribute to a positive living environment where residents feel safe, respected, and valued. I am committed to providing person-centered care and making a genuine difference in the lives of those who need consistent support. 2. What qualities make you a good fit for this role? I believe my empathy, patience, and strong communication skills make me an excellent fit for this role. I'm attentive to individual needs, reliable in performing daily tasks, and skilled in handling sensitive situations with professionalism. I also stay calm during stressful moments and can adapt to changing care requirements. My ability to build rapport with residents, families, and colleagues helps me create a supportive environment where everyone feels respected, understood, and encouraged. 3. How do you handle challenging behavior from residents? When dealing with challenging behavior, I prioritize staying calm, respectful, and supportive. I try to understand a resident's emotions, triggers, and unmet needs, then respond with empathy and clear communication. I avoid confrontation and use de-escalation techniques such as offering choices, redirecting attention, or giving space when needed. I also document the incident accurately and collaborate with a care team to develop strategies that promote safety, comfort, and positive behavior in the future. 4. How you ensure residents' dignity and independence. I ensure dignity by treating every resident with respect, involving them in decisions, and maintaining privacy during all care tasks. I encourage independence by offering support only where needed and allowing residents to perform tasks at their own pace. I promote choice, adapt care plans to individual abilities, and create an environment where each person feels valued and capable. My approach balances compassion with empowerment, helping residents maintain control over their daily lives. 5. Describe your experience with personal care tasks. I have experience assisting with bathing, dressing, grooming, toileting, and mobility support while ensuring safety and comfort. I follow hygiene protocols, respect privacy, and adapt my methods to each resident's abilities and preferences. I'm also trained in using manual handling equipment and monitoring for skin issues or health changes. My goal is to provide personal care that promotes dignity, comfort, and confidence while building trust through kindness and professionalism. 6. How you stay organized during a busy shift. I stay organized by prioritizing tasks, following care plans, and using checklists to ensure nothing is missed. I maintain clear communication with my team, adjust when unexpected needs arise, and document care activities promptly. Time management is essential, so I focus on balancing urgent tasks with daily routines. Staying proactive, calm, and flexible helps me deliver consistent care while ensuring residents' needs are met efficiently and respectfully throughout the shift. 7. How would you handle an emergency situation? In an emergency, I stay calm, follow established procedures, and act quickly to ensure safety. I assess the situation, call for help immediately, and provide first aid or support as required. I reassure the resident, keep others safe, and communicate clearly with my team. After the situation is under control, I document the incident thoroughly and report it to supervisors. My priority is always the residents' well-being and maintaining a safe environment. 8. How do you communicate with residents who have difficulty expressing themselves? I use patience, active listening, and nonverbal communication techniques, such as gestures, visual cues, and facial expressions. I give the resident time to respond, avoid rushing them, and observe their body language to understand their needs. I speak clearly, use simple language when needed, and reassure them to reduce anxiety. Building trust through consistent support helps improve communication over time, ensuring their feelings and preferences are understood and respected. 9. How do you manage stress in a care environment? I manage stress by staying organized, communicating openly with my team, and taking short moments to reset when needed. I focus on providing quality care rather than rushing, and I maintain a positive attitude even during difficult situations. After work, I use healthy coping strategies such as exercise, rest, and reflection. Recognizing my limits and seeking support when necessary helps me stay effective, patient, and calm throughout challenging shifts. 10. How do you build trust with residents? I build trust by being consistent, respectful, and genuinely caring in my interactions. I listen to residents' concerns, respect their choices, and maintain confidentiality. Showing reliability, such as arriving on time and following through with promises, helps residents feel secure. I approach each person with empathy, patience, and a non-judgmental attitude, creating a safe space where they feel comfortable expressing their needs and relying on my support. 11. How do you prioritize tasks when caring for multiple residents? I prioritize tasks by assessing each resident's needs, identifying urgent requirements, and following the care plan. Safety, medication administration, and essential personal care come first. I also communicate with colleagues to coordinate responsibilities and ensure no one is overlooked. Throughout the shift, I remain flexible and adjust priorities when unexpected situations arise. This approach ensures efficient, balanced care while maintaining residents' comfort and well-being. 12. What would you do if you notice a sudden change in a resident's condition? I would immediately assess the situation, ensure the resident's safety, and report the change to a senior staff member or nurse. I would clearly document the observations, including when the change occurred and any visible symptoms. I stay with the resident to provide reassurance and monitor their condition while waiting for further instructions. Prompt communication and accurate reporting help ensure timely intervention and prevent complications. 13. How do you work as part of a care team? I work effectively as part of a team by communicating clearly, sharing responsibilities, and supporting colleagues when needed. I respect different roles and collaborate to ensure consistent, high-quality care. I actively listen to others' input, provide updates on residents, and maintain a positive attitude. Working together helps create a safe and supportive environment for both staff and residents, improving overall care outcomes. 14. How do you handle disagreements with colleagues? I address disagreements calmly and professionally by discussing the issue privately and focusing on the facts rather than emotions. I listen to their perspective, share my concerns respectfully, and work toward a mutual understanding. If needed, I involve a supervisor to help mediate. My goal is to maintain teamwork and ensure residents receive the best care. I always keep professionalism and respect at the center of resolving conflicts. 15. What does person-centered care mean to you? Person-centered care means focusing on each resident's unique needs, preferences, and abilities. It involves treating them as individuals with their own choices, values, and goals. I strive to provide care that empowers residents, respects their independence, and adapts to their comfort levels. This approach builds trust, improves well-being, and ensures that every decision supports their physical, emotional, and social needs. It's about delivering care with dignity and compassion. 16. How do you ensure confidentiality? I follow confidentiality policies by keeping resident information private and sharing details only with authorized staff members. I avoid discussing residents outside the workplace and store documents securely. I also ensure conversations occur in private areas when discussing sensitive matters. Protecting confidentiality builds trust and complies with professional and legal standards, helping create a safe and respectful environment for everyone. 17. How do you support residents with mobility challenges? I support residents with mobility challenges by using correct manual handling techniques and appropriate equipment, such as hoists, walkers, or wheelchairs. I ensure safety by following care plans, assessing risks, and encouraging independence where possible. I move at the resident's pace, communicate clearly, and provide reassurance throughout the process. My approach prioritizes comfort, dignity, and reducing the risk of injury for both the resident and myself. 18. What would you do if a resident refused care? I would remain calm, respect their decision, and try to understand why they are refusing. I would offer choices, explain the importance of the care task, and attempt again after giving them some time. If refusal continues, I would report it to senior staff and document the incident accurately. Ensuring the resident feels heard and respected is essential while maintaining safety and following proper procedures. 19. How do you support residents' emotional well-being? I support emotional well-being by offering companionship, active listening, and encouragement. I create opportunities for meaningful activities and social interaction, helping residents stay engaged and positive. I pay attention to mood changes and provide reassurance during stressful moments. Working closely with the care team ensures that residents receive holistic support that addresses both emotional and physical needs. My goal is to help each person feel valued, understood, and emotionally supported. 20. How do you handle confidential complaints from residents? I listen carefully, reassure the resident that their concerns are taken seriously, and maintain confidentiality. I document the complaint accurately and report it to the appropriate supervisor following organizational procedures. I avoid making assumptions and remain professional throughout the process. Ensuring that concerns are handled promptly and respectfully helps build trust and maintain a safe, supportive environment for all residents. 21. What experience do you have with medication assistance? I have experience assisting with medication administration under supervision, following prescribed instructions and safety protocols. I ensure the right medication is given at the right time, dose, and method. I document everything accurately and report any concerns or side effects immediately. I understand the importance of maintaining focus, preventing errors, and supporting residents who may need reminders, encouragement, or help understanding their medication routines. 22. How do you support residents with cognitive impairments? I support residents with cognitive impairments by using simple, clear communication and maintaining a calm, reassuring approach. I follow structured routines to reduce confusion and provide cues or prompts when needed. I focus on maintaining independence, offering assistance only where necessary. Patience and empathy are essential, as well as working closely with healthcare professionals to provide consistent, person-centered support. 23. Describe a time you went above and beyond for a resident. I once supported a resident who felt anxious about participating in group activities. I spent extra time understanding their concerns and gently encouraging them. I found activities aligned with their interests and introduced them gradually. Over time, they became more confident and actively participated. This experience showed me how small, personalized efforts can significantly improve someone's overall well-being and social engagement. 24. How do you maintain professional boundaries? I maintain boundaries by keeping relationships respectful, avoiding over-involvement, and following organizational policies. I ensure my interactions remain supportive but professional, avoiding personal discussions that may compromise care. I focus on the resident's needs, not forming friendships or emotional dependence. Maintaining boundaries protects both residents and staff, ensuring ethical, safe, and effective care. 25. What motivates you to stay in this profession? I am motivated by the opportunity to make a real difference in people's lives every day. Watching residents grow more confident, comfortable, and independent brings me genuine satisfaction. I value the relationships built through trust and compassionate care. This profession allows me to use my strengths, empathy, patience, and dedication to positively influence others. The meaningful impact I can make keeps me committed to this work. Residential care work is a rewarding yet demanding profession that requires empathy, patience, and dedication. By preparing for these interview questions, you can confidently demonstrate your ability to provide high-quality, person-centered care. Remember to highlight your compassion, communication skills, and commitment to residents' safety and dignity. With the right mindset and preparation, you can stand out as a strong candidate and succeed in your residential care worker interview.